Impact of COVID-19 on mental health. As a result of the emergence of coronavirus disease outbreak caused by severe acute respiratory syndrome coronavirus infection in the Chinese city of Wuhan, a situation of socio-economic crisis and psychological distress rapidly occurred worldwide. Although social activities have been restricted in most countries, almost all essential individual movements were prohibited due to quarantine, while the local hospitals received thousands of critically ill COVID-19 patients and were forced to implement their emergency protocols. In this context, the general population as well as most of the frontline healthcare workers became vulnerable to the emotional impact of COVID-19 infection due to both the pandemic and its consequences worldwide. Many psychological problems and important consequences in terms of mental health, including stress, anxiety, depression, frustration, uncertainty during COVID-19 outbreak emerged progressively. Common psychological reactions related to the mass quarantine, which was imposed in order to attenuate the COVID-19 spread, are generalized fear and pervasive community anxiety, which are typically associated with disease outbreaks and increase with the escalation of new cases together with inadequate, anxiety-provoking information which was provided by the media. The psychological reactions to COVID-19 pandemic may vary from a panic behavior or collective hysteria to pervasive feelings of hopelessness and desperation, which are associated with negative outcomes including suicidal behavior. Importantly, other health measures may be compromised by abnormally elevated anxiety. As the general population became increasingly exposed, anxiety-provoking topics related to this emergence of the health and socio-economic crisis need to be rapidly identified to early detect dysfunctional processes and maladaptive lifestyle changes potentially leading to the onset of psychiatric conditions. Given this background, this work aimed to comprehensively review the current literature about the impact of COVID-19 epidemic on the mental health in the general population. Mental health has been affected due to isolation, frustration and boredom, pervasive anxiety. Complications. Mental illness may be a leading explanation for disability. Untreated mental disease can cause severe emotional, behavioral, and physical health problems. Complications sometimes linked to mental disease include unhappiness and decreased enjoyment of life, family conflicts, relationship difficulties, social isolation, problems with tobacco, alcohol, and other drugs, missed work or school or the problems associated with work or school, legal and financial problems, poverty and homelessness, weakened system, so your body features a hard time resisting infections, and heart diseases and other medical conditions. Preventive strategies. Specific preventive strategies at the community level such as implementing effective communication and providing adequate psychological services should be carried out in order to attenuate the psychological impact of COVID-19 outbreak. Health education needs to be enhanced using online platforms. Social fear related to COVID-19 needs to be correctly addressed, while stigma and discrimination need to be recognized as major challenges able to reinforce the feelings of uncertainty in a period of social crisis. Hospitals' protocols linked to the early and effective management of health emergency need to be implemented, while healthcare professionals need to be supplied by adequate protective facilities. Scientific community should provide appropriate information to attenuate the impact of anxiety, frustration, and all the negative emotions which represent important barriers to the correct management of social crisis and psychological consequences related to the pandemic. Unmet needs should be rapidly identified by medical staffs who need to communicate frequently and in a timely manner with most of the patients to understand the risk to develop new symptoms or worsen a pre-existing psychological distress. Furthermore, telephone helplines, internet access, active social networks, dedicated blogs, and forums should be implemented in order to reduce social isolation and loneliness as well, to allow specific population the successful communication with their loved ones. Marginalized populations such as elderly individuals or those with psychological problems should be able to actively consult with clinical physiotherapists to rapidly detect warning signs. Finally, telemedicine should be really implemented, especially in areas where mental health services are poorly represented or severely impaired by the rapid spread of pandemic and lockdown restrictions. Importantly, symptoms related to initial psychological crisis together with the need to perform effective interventions using personalization and monitoring of adverse drug reactions related to psychoactive medications should be detected by psychiatrists. To conclude with, implementing community-based strategies to support resilience and psychologically vulnerable individuals during the COVID-19 crisis is fundamental for any community. The psychological impact of fear and anxiety induced by the rapid spread of pandemic needs to be clearly recognized as a public health priority for both authorities and policymakers, who should rapidly adopt clear behavioral strategies to reduce the burden of disease and the dramatic mental health consequences of this outbreak.